At a recent Twin Cities clinic, nurses administered vaccines to Spanish-speaking communities. Then they were doling out doses at a predominantly black church. Events put on by mHealth Fairview, with nurse Ingrid Johansson leading the charge.
We've been vaccinating with these groups for years, and that really enabled us to move fast and bring this service out.
She runs the Minnesota Immunization Networking Initiative, a 15-year-old program that usually brings free flu shots to diverse communities, until it pivoted during the pandemic.
People have been very, very historically poorly treated in healthcare, and so going into a clinic is not a comfortable experience for some people, whereas receiving that service in their trusted space feels much more acceptable and safe.
Johansson has partnered with more than a dozen community organizations to break down language, technology, and trust barriers to ensure vaccine is distributed equitably and safely. A model so successful, the CDC even asked her to speak at a national forum yesterday to help others replicate it.
It's very rewarding, and it keeps you going, even though it is 7 days a week, 10, 12-hour days every day.
At these mini clinics, and thanks to those partnerships, Johansson says 5,000 eligible people of color have been vaccinated since January. Her calendar next month already booked as more vaccine comes to Minnesota.
That's just all really, really affirming, and that's what gives us our energy right now.
Jennifer Hoff.
We'll crash later.
KARE 11 News.
The Department of Health also has data that shows Minnesotans of color are more likely to catch the coronavirus. For example, African Americans make up about 6.5% of the population, but at one point accounted for 17% of infections.